Hi everyone, it's Katie Kelly. I'm one half of Motherhood Link, and I'm here today to talk about birth plans. Because birth plans, I'm not a huge fan of, and I think that a lot of people are surprised to hear that. What I am a fan of is birth preparedness. And what's the difference? So, a birth plan is when someone has their list written out of exactly what they'd like to do. In an ideal world, I want to go in, I want this to be an unmedicated birth, vaginal delivery, I want to use the mirror, I want to use the birthing ball, which is good. The difference between that and birth preparedness is almost coming up with a plan B and a plan C. So, I think this way for a couple of reasons. So, my first reason is that when people, not everyone, but I find some people get very tied to their birth plan. They might try breathing or like breathing pushing techniques, or they might try birthing positions and their heart gets set on that. And then birthing day comes and maybe baby doesn't move in that position, but they really want to birth in a squat or they really want to birth in a high kneel. And that's just not the way that it's going to happen. That I want someone to feel prepared to move into an alternative position, right? The same thing would hold true with pain management. A lot of women will get into the situation where they don't think they're going to require any pain management, and the day comes and they do want something, and maybe they haven't considered what types of pain managements there are. So there's pharmaceutical managements, there's non-pharmaceutical managements, and if you haven't investigated that because you've been rigidly planning birth one way, then you're missing out on that information. Secondly, I find what happens is if there's just one real rigid birth plan, is that if you then have to go completely off course, so now you have to use suction or forceps, or there's going to be an episiotomy or a C-section, that some women haven't even considered those options. And now recovery, you're playing catch up, right? So if you can be informed ahead of time of all of the different types of births, what the risks are for them, how best to recover for them, what can you do to prevent them, and start planning that in the pregnancy, then when something goes not according to your birth plan in the delivery room, you've got a plan B and a plan C and a plan D to fall back on. And in those first few days after delivery, when you might not have access to a doula or a midwife or your pelvic floor physiotherapist in hand, you already have that recovery, that first couple weeks of recovery plan already figured out for whichever type of birth had occurred, so that you're not left trying to find information on the internet. You're not trying to email practitioners who might not be able to get back to you fast enough. You're not trying to book an appointment that and no one can see you in time. That you have a plan set out already for you, that you know what to do. So give it a little bit of consideration. I would certainly say write down how you want things to happen, but make sure that you also allow for when things don't happen or go according to plan. And what is your plan B? What is your plan C? What is your plan D going to look like? So if you're looking for more information about that, you can certainly check out our website, www.motherhoodlink.ca. We've got lots of little tidbits in there. And you can also look at our Prepare to Push class, which does include things that you can do to help your pelvic floor prepare for vaginal delivery and things that you can do to help prepare for a C-section. And we also talk about the first 2 weeks of recovery afterwards. So hopefully that will be a useful tool for you, and it's there if needed. All right, bye-bye.